protection of the environment is a key element of sustainability, and we've talked about it quite a lot, but it's not the only one. And it's generally accepted that a business cannot be sustainable unless it fulfills also certain social objectives. So I would like to ask you this question, Jan. What are the main social topics that concern Southeast Asia pharmaceutical companies?
So you're talking about the SDG defined by United Nations. So I think it's interesting because definitely some are important. One definitely in Southeast Asia, if I have to compare with Europe, it's a gender equality. When I discuss with my team, my HR is a lady. When I discuss, she thinks that there is no, the gender equality is an issue in Southeast Asia. So that more male having a bigger position, in the region.
Talk about this panel.
So I have to deliver her message also about gender equality. After, there is a number 3 that it's about well-being, of course. As a pharma company, the objectives, and even Hyphen Pharma, our mission is to provide a better quality of life. So I think it's part of our DNA. Let's say one that is very important now, I think it's the one on peace and strong institution. This one is very important for 2 reasons. Because of war, because the war in Ukraine was 1.5 years ago and has really been disrupting the supply for more than 1 year because of the cost of energy, who has increased a lot with, and because we are a distributor, they increase their price sometimes by more than 50%. So it was a bit crazy if you look at what happened last year. Now we're trying to negotiate if we can lower, because now there is no more energy crisis, but always difficult to get back on this part. And strong institution, I think this is also very important, because to me, a strong institution is linked to corruption and bribery. And especially in low-income countries. Okay, not in Singapore, but other countries, something we are also looking at and trying to see how we can also. But most of the pharma companies are trying to put some rules now, code of ethics. Even if we are not at the same level as big American companies are trying, you can see that this is moving. And we know that in Asia, when they decide to move, they can move much faster than Europe and US. So what I would say.
That's clear. Another social aspect, particularly seen in pharma, is the fair access to medicine.
Yeah.
And what pharmaceuticals here in Southeast Asia do to contribute to this objective?
As I said, fair price, I think, is something very important, of course, because first, it's an out-of-pocket market. You go Europe, you go France, for example, we are French, we arrive, we go to the doctor, we go to the pharmacy, we don't pay 1 single cent. Here it's an out-of-pocket market, so it's much more, and especially in low-income countries. So it's really managing this is not easy because we are a distributor. So we cannot price the price we want, but we try our best on this issue. Trying to explain to our principal, and looking at the price structure to agree on a good price given, the market, and because the market is a bit heterogeneous in terms of pricing also. And what you have here in the region, we do have a lot of local players also having manufacturing facilities who are able also to lower their price and to make drugs more affordable. And actually, it's also the project of Healthier Singapore is to see how they are going to, the government of Singapore really pushing very hard. It's just the beginning of Healthier Singapore, also to lower the price and to make, the healthcare more affordable for everyone. And this is very important. And as a pharma company, we try to contribute in this direction. Definitely, yes.
Well, thank you, Jan, for this. Moving on to ESG. So there is G, which stands for governance, which is particularly important for healthcare industry in general, because we are talking about public health. So I would like to ask you these questions. You have experience in the pharma distribution here and in Europe. Do you think the regulations in place in Southeast Asia are efficient to maintain ethical sales processes? You mentioned bribery earlier. You know, what do you think? How would you see these regulations here?
I think definitely, as I said, maybe there is still a gap versus what you can see in Europe or in the US. For example, if I take the example of France, is something quite new. I don't know if you're aware, but there are this entreprise à mission, company with mission. I mean, it means that they are introducing in their bylaws, statements and trying to get some specific objective in social sustainability, environmental, and so on and so forth. So, and this is new. For example, one company, my previous company I was working with in France before moving to Singapore 5 years ago, is now an entreprise, a company with mission. And it's inside its bylaws. So it's very strong. And you have to get, you have specific targets and you have to hit the specific target. And if you don't hit the target, they remove and you cannot state anymore that you are a company. And Danone, for example, is entreprise à mission in France. So this is only France, but this is maybe started less than 10 years ago. And so I think clearly in Southeast Asia, in the pharma industry, because we are a highly regulated industry, maybe corruption, bribery, all this stuff, maybe not so. And really, you can see now that a lot of companies are really pushing their code of ethics and to show that they are complying also. And we are a listed company ourselves, so we cannot play with it. I mean, it's very serious.
So
in Singapore,
it would go beyond regulation. That would be self-imposed regulation, so to speak. So it's not so much whatever.
Today, people are putting their own rules. I think it's very important.
And talking about your own rules, one of the aspects is the price that the drugs are available at, which can be inflated when the drugs are not generally available in certain countries in the region. Again, this is not Singapore, but other countries in Southeast Asia. Can you avoid or try to avoid the undue inflation of product prices?
I will say that for drugs, it's quite straightforward in that sense that, the channel, of course, even if in our industry we are, operating in a lot of channels, different channels, hospital, pharmacy chain, and also across a lot of countries. Southeast Asia, we're talking about 10 countries. I think for drugs, it's quite straightforward. We can control the price we sell to hospital, to private clinic, and there is no excessive pricing that we are. You can control your in a way your pricing for drugs. When it comes to consumer healthcare, also that it's a big market, and it's a different story because but not to find your product expensive, but actually cheaper online. Because, in Southeast Asia, most of the time, consumer products are more expensive than what you can find in other parts of the world. And so people importing directly. So online, it's a good. So I will say that it's quite a healthy market, Southeast Asia, because for the consumer healthcare business, the strong development of e-commerce that is making kind of competition, not really fair competition for for us. And but for the drug market, I think is quite okay. And I have not seen in 5 years any crazy someone trying to sell products to make more money. No.
Another aspect of governance when it turns to pharmaceutical products is the availability or the risk of having fake products on the market. How can you mitigate that? How can you act as a Southeast Asian pharmaceutical distributor? How can you try to avoid that from happening?
So getting back to Europe, for example, I don't know, but if you're aware that in 2019, just before I left to Singapore, they put in place what they call a serialization project. So actually, it was mandatory for all drugs. You have every box has a single number, so you can track and you can exactly know where the drug is coming from. So this has been put in place in Europe in 2019. So surprisingly, in Asia, 5 years after, or 4 years after, it's not really a topic. In Indonesia, yes, as from 2025, they are asking for all drugs to serialize, your product. So you will be really able to identify. And to because when it comes to fake products, it's not only the industry, it's also to educate the consumer. You have to educate when he buy a product that he need to be how he can be sure that this product is not a fake one, a counterfeit one. And so you have to educate your doctors, your patients, and of course, as I said, to the serialization. And what we are doing also in top of serialization is something we're trying. You can put a seal, so you are also sure that you have a double serialization. You have a tamper-proof and packaging, so you can do a lot. It's actually what we are doing. But it's a topic. It's a topic because in the region, you do have a lot of also parallel import. You buy a product, you are in Malaysia, you can buy a product from Korea, but so you have to be sure. So when you sell the product to doctors or to hospital, that your product is because of a seal, the serialization is not a fake one.
Well, gentlemen, thank you very much for this insightful discussion. It was very interesting to hear about ESG in healthcare. We see that 2050 seems a long way away, but we see that the issues are here today. A lot is being done across industries to try to mitigate these risks, but a lot remains to be done as well. So we've got a good years, of hard work ahead of us. Thank you very much.
Thank you very much,
Thank you,
Owen. Thank you.